Alright, let's talk about a monthly subscription that everyone hates but feels forced to buy: health insurance. You pay for it every single month, dutifully. The money just vanishes from your bank account. You see that charge and you tell yourself, okay, this is for peace of mind. This is my safety net. If things go sideways, I'm covered. It's a deal, right? You pay them now so they'll pay for you later. It's a simple contract. You hold up your end of the bargain, expecting them to do the same when you actually need them. This is the promise they sell you, wrapped in a glossy brochure with pictures of smiling, healthy families. But then, the moment of truth arrives. You get sick, you go to the doctor, you need a procedure, and suddenly, that simple contract gets complicated. You submit a claim, thinking your safety net will catch you. Instead, you get a letter. A denial. This treatment is not medically necessary. Or my personal favorite, this is an experimental procedure. Suddenly, the company you've been paying for years is acting like a skeptical parent questioning your life choices. You paid the premium, you followed the rules, but when it's their turn to pay up, they hit you with the fine print. It's the ultimate betrayal. The frustration is real, and it is deep. You're navigating a health crisis, and now you have to become a part-time lawyer, fighting your own insurance company. You're on the phone for hours, bouncing between departments, explaining your situation over and over again. It feels like they're just trying to wear you down until you give up and pay the bill yourself. It's a battle of attrition, and they have all the time and resources in the world. You, on the other hand, are just trying to get better. The whole experience makes you question the very purpose of the system. Is this really about health, or is it just another business designed to take your money? And here's the kicker. Your premiums keep going up. Every single year, you get a notice that your monthly payment is increasing. But are your benefits getting better? Nope. In fact, they seem to be shrinking. Your deductible gets higher, your co-pays increase, and the list of what's not covered gets longer. It feels like you're paying for a deluxe cable package, but only getting 2 fuzzy channels and a whole lot of commercials. You're pouring more and more money into a bucket with a hole in it, and the people who sold you the bucket are just shrugging their shoulders while counting your cash. So you've managed to get your insurance to approve a hospital stay. Congratulations, you've won the first battle. But guess what? The war has just begun. Welcome to the hospital where the rules are confusing and the prices are made up. You'd think that your insurance plan would work the same way everywhere, right? Wrong. Every hospital seems to have its own secret handshake with the insurance companies. What's covered at Hospital A might be only partially covered at Hospital B, even if they are both in-network. It's a labyrinth designed to confuse you. One of the biggest games they play is with room charges. Your insurance might say it covers a hospital room, but they often put a cap on how much they'll pay per day. For instance, they'll cover up to $200 for a room, but the hospital charges $500. Who pays the extra $300? You do. It's called an excess payment, and it's how they get you. The same thing happens with the ICU. Your insurance has a limit, but the hospital's charges are sky high. You're in a vulnerable position and they know it. You're not exactly in a state to shop around for a cheaper ICU bed while you're having a medical emergency. Then there's the distinction between medical and non-medical expenses. This is where it gets truly absurd. The hospital gives you a bill, and your insurance company gets out its red pen like a high school English teacher. They start circling things. Gloves, non-medical, syringes, non-medical, registration fees, definitely non-medical. These are items that are essential for your treatment, but the insurance company reclassifies them to deny the claim. These non-payable charges can add up to a huge chunk of your final bill, leaving you to cover costs for basic supplies that the hospital should provide. So, you end up in a financial pincer movement. On one side, you have the hospital hitting you with all these extra charges. On the other, you have your insurance company refusing to pay for them. And let's not forget, you're also a taxpayer. You pay taxes that are supposed to help fund a functional healthcare system. So you're paying your insurance premium, you're paying the hospital's excess charges, and you're paying taxes. It's a triple dip into your wallet. You are effectively being taxed twice for a service that is failing you at every turn. Let's pull back the curtain for a second. Who owns these hospitals that are charging such astronomical prices? Often, they are not just standalone community centers. They are massive corporate entities owned by some of the richest and most powerful people in the country. We're talking about private equity firms, billionaire investors, and massive conglomerates. These are not people who got into the business of healthcare out of a deep-seated desire to heal the sick. They got into it because it is an incredibly profitable industry. Their primary goal isn't patient outcomes, it's shareholder value and return on investment. This brings us to the big question. Where is the government in all of this? Why are they allowing these unfair practices to continue? The government's job is supposed to be to regulate industries and protect consumers, especially in a sector as critical as healthcare. Yet, they seem to be asleep at the wheel, or worse, complicit. They allow a system where prices are opaque, billing is predatory, and insurance companies can deny essential care with impunity. Instead of ensuring everyone has access to affordable, quality healthcare, they seem to be enabling a system that enriches a powerful few. You have to wonder if there's a bigger, more cynical connection at play here. It feels like there's a coordinated dance between the hospitals, the insurance companies, and the pharmaceutical industry. The hospital charges an insane amount. The insurance company agrees to pay a fraction of it, making themselves look like the hero while still leaving you with a massive bill. And Big Pharma? They're setting the prices for life-saving drugs at levels that would make a king blush. It's a triangle of profit, and the patient is stuck in the middle, getting squeezed from all sides. This entire structure seems to benefit from a lack of transparency and a mountain of complexity. If the average person can't understand their bill or their insurance policy, they can't effectively fight back. The system is designed to be overwhelming. The powerful people who own these institutions have lobbyists and lawyers to ensure the rules are written in their favor. Meanwhile, the government, which should be the referee ensuring a fair game, often seems to be cheering for one team. Is their duty to the people they serve or to the powerful corporations that fund their campaigns? Here is one of the most infuriating parts of this whole mess. The price you pay depends on who you are. If you walk into a hospital with a good insurance plan, the hospital might bill $10,000 for a procedure. The insurance company will then negotiate it down to $4,000. But if you walk in with no insurance and offer to pay cash, they might charge you the full, undiscounted rate of $15,000. How does that make any sense? The price is completely arbitrary. It's not based on the cost of the service. It's based on what they think they can squeeze out of you or your insurer. This whole system has shifted its focus from healing to billing. It feels like the primary function of a modern hospital is not to provide care but to generate invoices. Every single thing you receive, every minute you spend, is meticulously coded and billed for maximum financial return. The doctors and nurses on the front lines are often amazing, dedicated people, but they are trapped in a corporate structure that prioritizes profits over patients. The administrative bloat in hospitals is enormous, with entire departments dedicated to coding, billing, and fighting with insurance companies. That is where the money is going. And while all of this is happening, the money continues to flow upwards. Premiums rise, but that extra money isn't going towards better care or lower deductibles for you. It's going to massive profits for the insurance companies and staggering bonuses for their executives. These CEOs are making tens of millions of dollars a year by creating a system that denies care to the people who fund their salaries. It is a fundamentally broken incentive structure. The less care they provide, the more money they make. How can we ever expect good outcomes from a system like that? So we have to ask the final uncomfortable question. Have the government and the healthcare industry forgotten their fundamental duty? Healthcare should be a public service, a basic human right. Instead, it has been transformed into a commodity to be bought and sold for maximum profit. The system is no longer serving the people. It is serving the powerful interests that control it. It's a modern scam, hidden in plain sight. And we are all paying the price, with our money and with our health. The promise of care has been replaced by the reality of commerce, and we are all left wondering who is actually looking out for us.